Okay, so we're back for part two, and that is to hear what you actually did. How did you deal with this situation? So much change happening all at once at multiple levels with limited resources. So, what was the solution?
Yeah, so I knew we needed to take action. My team knew, and this is definitely not just me. I had great staff and wonderful people that I was working with that also were very enthusiastic about doing what we could to communicate these changes. And looking back, I think we handled it really well considering the resources that we had. As we neared the end of the year, I think things became more urgent. I think, higher ups at HealthNet began to reach out to commanders. And so my commander kind of took notice that he needed to be paying attention to this. And that also came from an uptick in patients coming to our offices and, going to the C-suite to complain and things like that. So the mood kind of changed. It was a little last minute, but we did start getting buy-in. And so I said, I really want to do this as a campaign. And he said, okay, fine, give me a brief on what you're going to do to communicate changes and we'll go from there. And I came up with, or my team and I absolutely came up with a lot of solutions and ways to get the word out. And he approved of all of them, which we weren't expecting. And so we did have a lot of work to do, but I think it really made a big impact. And we used the hospital Facebook page. We have a public affairs office at the hospital that helped us publish newspaper articles in both the Army-based newspaper as well as Colorado Springs. We communicated changes on our Facebook page. We created flyers and infographics, and we displayed them on the televisions in the waiting rooms across the hospital. We got the commander to do a commercial, which he reluctantly agreed to. And in the local news, we briefed changes at every staff meeting I could get on the agenda for. We really wanted to get staff buy-in, so we focused a lot on also educating the staff at the hospital because, your front desk staff are going to be the first people that the patients see. So we gave them stacks of paper summarizing all of the changes so that they could give them to their patients when they checked in. It was, information on how to register for your logon for the new database. I mean, we did infographics where we showed them exactly how to navigate to creating those accounts and things like that. We got on board with briefing other units all across the base, so they were able to communicate changes to their soldiers. We briefed at family readiness meetings. These were family support groups for soldiers and their families, and they helped us get the word out. And
let me just pause you for a second. So, like Fort Carson is fourth ID still there? Is that?
Yes, fourth ID.
So fourth ID is a 4th Infantry Division. It's like 20,000 soldiers, right?
Yep.
Who are not medical people. So you got to remember that this is the community that Major Walls was supporting, right? So you're talking about going and visiting the infantry units and telling them about the benefit. So.
Yes, I actually did do a few briefings. I would get in touch with medical planners. The division did have each brigade is 4,000 to 5,000 soldiers, and they have their own medical planner. And we would partner up. I would go brief, give them documents. There's also a sustainment brigade on the base that we briefed to, and that was really helpful. And hearing the questions that people ask, we realized that they, as much as we tell people to take command, they have so much going on in their lives. And if they're not, necessarily using their healthcare benefit at that present time, they're not necessarily going to pay attention to a flyer on a counter. And so we really thought it was important to get in front of people as much as we could, and just really, it helped people realize what a priority it was, and that if they didn't take responsibility with their healthcare plan, they might miss open season, or they might be shocked when they got a bill for a copay, or had trouble, or why didn't they get an authorization in the mail? And so we were able to kind of get in front of that messaging and help them out. So we saw a lot of gratification and benefit there. And at the end of everything, this was in February of 2018, we held a big town hall. And that was an opportunity for people to come to us. I was able to moderate a panel, and I had a representative. It was actually the VP of operations from HealthNet physically came down. We had representatives from the Colorado Springs Military Health System, TRICARE, one of my senior colleagues came down for that, and our commander and the Air Force Clinic commanders. And people asked them questions. They vented about copay anger and having to, pay more for things and having to get used to a new network and express their frustrations that way. And we also streamed that through Facebook Live, and people were able to ask questions there. And it was a really good event.
Yeah. So an example you just used, like two things that changed. One was the copay itself. That would have been a TRICARE, like Congress decided that, not HealthNet, not the contractor.
Mm-hmm.
So that we were talking in the first part about the layers of change. So one example would be like, why am I paying more? Why am I paying more for my copay now? And they'd look at the hospital commander who had zero influence on that, or they might look at HealthNet, but it was actually a congressional decision. It was a policy change. But then you did have HealthNet did make the decisions about what doctors and what providers would be in the network and which would not be in the network. So that was that's kind of I think that's the multiple changes happening is really what makes this situation interesting.
And for the town hall, we brought them together. So we had a TRICARE representative for the region and HealthNet there. We all worked together. I crafted an email for the commander to send to them to invite them to this town hall. And I did this like 4 months in advance. And I was shocked that all of them came. And I had just actually asked for a representative from HealthNet, and the VP said she would be there. And that really hit home, I think, how important this was. People realizing it towards the end of the year that it would mean the most probably if she was the one there. And we definitely wanted those people there to help the commander out, because as you said, he was not the one, we were not the ones in charge of all of these changes, but we were the messengers, and we were the ones there on the front lines, if you will, being there for the patients when they had questions about those things. They weren't going to pick up the phone and call HealthNet. They were going to come to us. They wanted to see a person. They wanted that face-to-face.
So I was just going to kind of summarize. So you had a whole campaign of public affairs kind of approach. You had social media through Facebook. You were out going into the community, talking to different organizations that on Carson. You were publishing articles in the newspaper, both the local newspaper as well as the Fort Carson newspaper. You had your commander on television, and then you had this big town hall where people could actually come in and so that's a lot.
It was a lot. It took over my life for 6 months. Yeah. And I won't get into sort of the aftermath, but we had issues. We're still having issues at Fort Carson and throughout the West with this contractor. They've made a lot of improvement, but there are still provider shortages. They have issues with access because they shrunk the network so much. And the TRICARE changes, I think people, accepted, the small increase in the copays and the premiums. I think that has gone relatively well, but the performance of the contract was an issue for a little bit. And unfortunately, I changed out of the job only a year after I had taken it. And so the staff there and my replacement did continue to use the momentum that we had created to continue educating, and those channels that we had created, those lines of communication with other teams across post in the community. That stuff really served us well for continuing to communicate some of the shortcomings that we were working through. So
I think a point I was making a second ago that I want to reiterate, and along with what you were just saying, is you guys were the messenger. You guys were even though you had very little control over the situation, the responsibility to communicate this wound up kind of coming down on you. It was kind of, the patients weren't discerning between you and HealthNet and TRICARE. They just saw you as the military healthcare provider, and you need to fix whatever their problem was. It's like, yeah. Okay.
That's exactly what it
was. So in retrospect, what would you have done maybe differently? I think it sounds like a lot of great stuff. What were the lessons learned for you?
I think I'm really proud of everything we accomplished. It seemed so chaotic at the time. And I think that if we had been able to formalize more of a committee or a working group, to help manage the task in front of us, it sort of seemed like it was a volunteer effort. It was like, whoever is enthusiastic about working on this with me, let's do this together. My staff was all in, but we needed stakeholders in other parts of the hospital too, because we certainly couldn't do it alone. We couldn't operate in silos with something this large. And so having a more formalized task force, I think, would have helped, a more formalized agenda. I was flying by the seat of my pants for a lot of this. I didn't know who the last liaison was. Nobody had any recollection of when the previous contract change had happened. And they certainly didn't think that there were those kinds of issues. Like, it wasn't that chaotic before. There was no continuity or lessons learned that I could find written anywhere to help me with this. And so we were really kind of creating it. And I think every small win that the commander would approve something and say, go for it and run. Every time something succeeded, like if we had a successful briefing to people or if we helped a patient out, we used that to, keep the momentum going and create more wins. Basically, it's like we were able to say, oh, this is working. And then everyone would see that and be like, okay, come brief our patients or come here and talk to us about this. And it gained traction, and we were able to build off of that, which I think was really successful. I do think the way that we put people into jobs, this being my first job coming out of Army Baylor, I was in over my head at times. And I think that the liaison role being sort of an additional duty was a disservice to our organization. And I don't think we quite understood the magnitude of what was happening to us. And I think that could have been better handled if people had maybe more experience, or if perhaps they had sent people to come and help us on the ground. I think that would have been helpful. And the working group, definitely, I think no matter how much we did, I do think that some beneficiaries missed out on changes and the communication. And so having more stakeholders potentially on that more formalized team to say, why don't we go here, and just getting more ideas from more people, because we work so much better as a team, and I alone couldn't come up with those ideas, and I could have potentially expanded that, which obviously would have been helpful if I'd had more support earlier in the game. When we first realized this was going to be large, at the end of that summer, if the commander had bought into communicating right away, we might have been able to do a little bit better there. As far as a leadership lesson for me, I think things that I would want to, pass on to others is, you can be asked to do really big things when you just feel like a rookie. And you might think how something is going to work out, but you find yourself in this huge task is sort of put on your shoulders, and you're forced, to figure out how to do it sort of by yourself. And you might think you know how to do it, and you really need to fight for what you believe in, I think, because you're in the role you're in for a reason, and people have expressed confidence in you. And I think that you should certainly fight for what you believe in and what you think is the right thing to do. And I maybe could have done that a little bit more to make sure that my voice was heard, and that our beneficiaries really were going to need our help in communicating things, and that we needed to do it together. So I think I would have pushed back a little bit more, but it's easy to say looking back. And I think people have different perspectives in whatever level of leadership that they're working in, and people at the top have their own priorities, and your mid-level managers have their own priorities too. And we can see things in a different perspective at that level. And that's just another justification that we need to make sure that we're advocating for our people and our roles and responsibilities, and making sure that those priorities are communicated to the top, I guess. Yeah.
Well, thank you so much for sharing your story. This is really great. What an adventure. I like your lessons learned in particular about working group would have made sense. My sense is maybe this wasn't supposed to be a big burden on your organization, which probably was part of the problem to kind of get the momentum going to begin with. And yeah. All right. Well, thank you so much for your time today. It's been great.
Thank you for having me.